We are in the age of amazing facelift results, and I feel so lucky being a facial plastic surgeon in this particular time in history. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I'm here to tell you about the top 5 things that I think distinguish a good facelift result from a great facelift result. Now, you may have heard of the book Good to Great. I do listen to a lot of business podcasts, read a lot of books. What that book talks about is how a good business can transition into being a great business. And I think of surgery in the same way. And I've come up with a couple of things that I think, just by looking at my own results as well as other surgeons' results, that I think distinguishes those wow results from, okay, they look good, but there's something else that's missing. So number one is, I think the technique used in a facelift makes a big difference. So when I was in training way back in the day, most people weren't doing a deep plane facelift, even though it's been around since about the 80s. It fell out of favor. It was viewed as too risky. But there are several surgeons that have spent a lot of time teaching courses, teaching other surgeons of how to perform deep plane facelifts with predictable results, with very safe results. And these days, most people doing a lot of facelifts end up doing deep plane facelifts. And I think that has been the biggest game changer in how good the results can be, how long they last, how much lift you can get. Even the direction of lift that people are doing now has changed a lot, even in the last 10 years. And so that is one of the top things that I have seen makes the biggest difference. So now if I see results from a traditional SMAS facelift, with some exceptions, I'm just a little underwhelmed. Now, the number 2 thing that can distinguish a good facelift result from a great facelift result is overall skin quality and texture. Now, if someone is not doing anything for their skin and they wait until they're in their 60s or 70s, they have a lot of sun damage, a lot of deep wrinkles. If they're not addressing their skin either before or after or both around the time of a facelift, it takes away from the facelift result completely. You can even see some of the stretch on the skin just because you can see those wrinkles are changed in directions depending on where you're at. The skin doesn't re-drape naturally. It still doesn't reflect light in an attractive way. It absorbs light and it's just more dull, and you end up not having as long of a result as well because that skin just has no structure to it anymore. What I recommend for my patients is, before a facelift, what I call prepping the canvas. When you think of in terms of painting, when you prepare the canvas for any kind of portrait or anything that you're doing, you want to gesso the canvas, and that provides a layer that the paint can sit on. And in the same way, painting a wall, painting a piece of furniture, you want to prime that area so that it can accept the paint a little better. So in the same way with skin, I will treat the skin with both radiofrequency microneedling that I found can thicken the dermis a little bit, as well as a deep laser resurfacing using an erbium laser. And sometimes I use full field, sometimes I use fractional laser. But rebuilding the skin scaffold really helps a facelift result go from good to great. Now, the third thing that distinguishes a good facelift result from a great one is the technique used in treating the neck. Now, some people have a very favorable anatomy. They don't have big muscles under here. They don't have big glands. They just have a nice smooth jawline, but the skin is just hanging down a little too much. And in that case, your traditional platysmoplasty with the deep plane technique is adequate. But some people have bigger structures that need to be addressed. It pops out to me immediately now when I see a post-op result where that wasn't addressed, where it was needed. What I do in those cases is a deep structural neck lift, where I can trim the digastric muscles, sometimes stitch them together, sometimes even dividing the muscles altogether. Sometimes the submandibular glands need to be trimmed as well. In both cases, I do make the platysma muscle almost like a sling. So I'll suture the muscle in the middle and then tuck it back behind the jawline so that you get that nice smooth contour along the jawline. So if there's a surgeon that's not comfortable doing those deep neck structural techniques, it will take away from the overall result if that person has unfavorable anatomy. Now, the number 4 reason that a facelift may be good instead of great is that the forehead was not addressed. On the face, as you get older, starting in your early 20s, you lose about 1 to 2% of collagen and elastin in the skin year by year. So it's not just the lower face and neck that's happening to, it's the forehead, the lip, everywhere. So a true full face rejuvenation includes addressing the forehead. And what that means is the brow position, even the brow ridge, the hairline position. I think of that as more of a holistic approach rather than just doing a brow lift. I typically will do a pre-tracheal approach to a brow lift, and that's because I think of the forehead in the same terms as I do a deep plane facelift. So to get the best brow lift result, I need to release some ligaments on the side here as well as around the orbit and release any structures that's keeping those brows from being able to lift in a more natural way. I don't like to use permanent plates, endotines, anything like that to lift the brow because I want them to move freely and I don't want anyone to have long-term pain or irritation from implants there. I like pretracheal approach. It heals really well, but that also gives me access to the brow ridge here. Now, some people have hooding over their eyes from the bone itself, not just the brow sitting a little low or extra skin. And if you don't address the brow ridge there, it will actually still create shadowing and hooding over the eyes and still make you look a little older, a little masculine. So if I need to do that, I include that in my forehead portion of the procedure. But many surgeons don't do that part of it, and I notice right away. Now, number 5 in changing a good facelift result to a great facelift result is doing a lip lift. Now, like I said before, the forehead is part of that same continuum of aging as the lower face and neck, and this happens around the mouth as well. So if you don't address a long upper lip with your facelift, it will be more noticeable than before their surgery. And so if you haven't heard of a lip lift, I make a little incision at the base of the nose. It's almost like a little mini facelift for your mouth. So I remove a little strip of skin to shorten the distance between the nose and the upper lip. Now, the facelift itself will lift the corners of the mouth slightly, but some people still need to balance out the shape of their lip with a corner lip lift where I make a tiny incision right at the edge here because I want your upper lip to still look very natural. Some people, in addition to the lip lift, need a little volume placed, not to give really big plump lips, but to just fill them out, make them look more hydrated because you lose volume in your lips as you get older as well. So all those little tiny details make a big difference. And when I can do everything combined in our full face rejuvenation package, I get a much better result than if someone just comes to me for just a face and neck lift and doesn't want to do anything else. I hope this really helps. Again, I'm Dr. Sarah Saxon. Don't forget to subscribe to our channel to get more helpful information.